Okay, hi. My name is Francesca. That's my badge. I'm here to demonstrate or to assess my client for the cranial and the reflex, to assess them for their reflexes. And to start with, I'm gonna sanitize my hands. I'm gonna provide privacy. And privacy is done after I sanitize my hands. I have enough lightnings in here. And I'm going to explain to my client what I'm going to do.
Okay.
So, Mrs. Client, good afternoon. My name is Francesca once again. I'm going to be examining you for your cranial nerves, that's your face, your neck. Is it okay?
Yeah.
Okay, so I got my client's consent. I'm going to be doing the reflexes as well.
Oh, okay.
So if you give me permission, I'm going to just start right away. So again, I sanitize my hands. I'm going to start for the cranial nerves. So a few questions for you. You know, I check everything is okay. You look good. I check the status. Just want to ask you a few questions. Do you have any problems swallowing?
No.
Do you have problems like speaking?
No.
Do you have any headaches?
No.
Feel dizzy?
No.
Do you have any tremors or something going on? Okay, so I've got my client's mental status. My client is perfect. I'm going to go right into carrying out the 12 nerves. So the first one I'm going to do is just to check your olfactory, which is the smelling.
Yeah.
So for the smelling, I have something here. Just a second. I'll be right back. So this is coffee. So I have that. I'm going to have you smell that. But to start with, I want you to just close one of your nostrils and breathe into the other one. Okay. Second one. So I checked that. She could easily breathe in and out. And then the next thing is I have this container right here. I'm going to just have you close your eyes. I'll take you through the nose and tell me what you smell. What do you smell?
I smell coffee.
Coffee, thank you. So that cranial nerve is perfect. That's coffee right in there. The second one we're going to be doing is to check for your optic nerves. The optic nerve is cranial nerve number 2. I'm going to be doing the confrontational test. So I'm going to have you close the right eye. And I'll have this side closed. And I just need you to tell me yes when you see my finger. Just look straight into my eyes, don't look elsewhere. When you see my finger shake, just tell me what you feel.
No.
No, okay.
No. No. No.
So I check for that cranial nerve, I check that, and then I see that that is perfect as well. That's cranial nerve number 2. I'm gonna be doing number 3. Okay, so now, okay, we do for both sides. We do for the right eye, we do for the left eye, and we check that both are fine and okay. And next we're going to be doing for cranial number 3, I'm going to be doing for 4, and I'm going to be doing for 6. So 3 is the oculomotor, the 4 is the trochlear, and then the 6 is the abducent.
Yeah.
So for that we're going to be doing the cover test for those 3. And for the cover test, may I have you close your eyes? You close that eye, and then what I'm doing here is I'm trying to check to see if there's any shaking, if there's any involuntary motion in that eye that is uncovered, and I actually don't see that. That looks perfect. Can I see the other one? Okay, so I'm looking at that also, and I see that that is perfect as well. There's no muscle weaknesses or anything. So cranial number 3, number 4, and number 6 is done. Now I'm going to do number 5. Cranial number 5 is one that tests for your trigeminal. So I'm going to be trying a trigeminal, which is number 5. And for that one, I'm just going to be checking, to see if everything is looking okay for your trigeminal. What's that trigeminal? Trigeminal. Checking if everything is fine for your trigeminal. Oh my God, I forgot what that is. So that I'm going to have you clench your teeth, clench your teeth, and if she clenches her teeth, I just wanted to feel the muscles of the temporal, feel the temporal muscle and feel all the muscles on the face to see if it's firm. So checking all of that on both sides to see they're symmetrical and they're strong enough, there's no weakness of any kind. That is also fine for number 5. Now I'm going to number 7, the cranial nerve number 7, which is the facial nerves. For the facial nerves, I'm checking the facial symmetry. I'm going to be asking her to frown. Okay, I'm going to ask her to close her eyes tightly. Trying to open it, but it's still firmly closed. I'm going to see in the forehead. I see her smile. I see her frown, her face, and everything looks fine for the cranial number 7. The facial looks symmetrical. There's no drooling on each side, so everything is fine. Going to cranial number 8. That is the audio nerve. It's also checking if she could hear me. So I'm going to have this side of her ear blocked, and I'm going to whisper something, okay? Tell me what you hear.
Occupation.
Okay, that's fine. I'm going to close the other one.
Age.
So she's good with that. I hear, she told me what I whispered to her, so that is also fine. That part is good. Next one I'm going to be doing is number 9. Actually, for that number 9, it's called the glossopharyngeal. I'm gonna depress. I'm not actually gonna do that because it's a little bit invasive. But I'm gonna tell you what I'm gonna do using this tongue depressor to kind of palpate. Okay, I'm gonna be palpating to see the uvula. And when I do that, okay, it's just an imaginary one. I palpate the uvula, I see that it's at the midline, and I'm gonna ask her to say ah. Ah, okay, so she said ah. I can see that, the voice is coming out good. I can see the quality of the voice that is fine, and that's also cranial number 10, which is the vagus one. So number 11, cranial nerve, is the one that you would have to, I just wanted to check, to see if you can turn your head this way, turn it this way, against resistance, again, okay? And then I'm gonna just, I want you to just trigger your, okay, down. That's fine, number 11 is okay, and the number 12 is one that shows the movement of the tongue, and I'm gonna have you just stick out your tongue. That is fine, she does that. Can you wiggle it to the side, wiggle it to the next side? Number 12 is done. I can see strength in there. There's nothing, weakness of any kind. That is cranial number 12, which is done. And next one I'm going into now, I'm gonna be doing the reflexes, okay? I have my reflex hammer here. And for the reflexes, I'll be checking for her bicep. So I would have to touch you a little bit now. So I want to check for her bicep, and here we have the bicep. I'm going to look out for the tendon right here, and I'm going to just put my thumb right here, and I will hit on my tongue, and you will see a contraction and a reflection on this on the side. So I'm going to go ahead now and hit my tongue. Okay. Yeah, you can see that going on in there. So again, I'm going to do the brachioradialis. That one at the bicep is checking for C5, C6. So now I'm going to be doing the brachioradialis, also checking for C5, C6. And this is the landmark. Just trace it down here, somewhere around here, and just hit it. You can see that the hands actually moved. And after that, I'm going to do the tricep. So tricep could be found somewhere around the elbow here. You ask the client to dangle the hand a little bit so you can actually get it up here. And when you hit on that, what you're looking for is just to see that there is movement in there. So I'll do that. So we got that done on the tricep. Next what we'll do is to do the patella. So the patella is actually checking for L2 to L4. Patella, for privacy, patella is somewhere around here, just below the knee cap. So you find the tendon somewhere around here. Relax your legs, and if possible, just do something for yourself. So right here, okay, is where you have it. So that is that's the patella, which is done, and we have the ankle jack too. It's gonna be behind here. Same time, I will come here, just behind here, and I will hit it to get her to move there. That's done for that. And the last one that I have to do is to check for the clunus. So the clunus, I will just hold her. I just hold her legs, hold it firm, and I will let go and see, if it could fall back right away or if it's gonna be shaky. So you can see that it went back right away. Do it again. It went back right away. So what we're looking for in there is if the client had any tremor or the feet is just shaking unnecessarily, you actually verify that by doing that. So all that is covered for my reflexes. I did the bicep, I did the brachioradialis, I did the tricep, I did the patella, I did the ankle, and I did the clunus. So thank you for watching and have a good day.